in some technical difficulties.
You send me the link in the mail, but I'm not sure. Okay.
Meeting of Human Resources for Health Caribbean Commission. This meeting is jointly coordinated by the Caribbean Secretariat and the Fundamental Organizations. So I just want to welcome you to this meeting and call the meeting to order. At this time, I would like to ask Dr. Serena Bender-Pelswick to do the roll call.
Good morning, all, and thank you, PM. And so we begin the roll call. We ask, is there any representative from Antigua and Barbuda present? Any representative from the Bahamas? Is there any representative from Barbados? Any representative from Belize? Well, I see Chair there. Chair, is there any other representative with you?
No, it's just me present.
Okay, thank you. Is there any representative from Dominica?
Yes, present. Fernanda Raymond.
Welcome.
Thank you.
Is there any representative from Grenada?
Yes, present. Mr. Edwards.
Welcome.
Thank you.
Is there any representative from Guyana? Okay. Is there any representative from Jamaica? Is there any representative from Montserrat? Is there any representative from St. Kitts and Nevis? I see the mic is open. Is anyone from Samsung SMG? Is that the person from St. Kitts?
No, I'm from University of Guyana. I'm Dr. Cummings. Let me change my name, right?
Okay, thank you so much.
Dr. Cummings, University of Guyana, not Ministry of Health, University of Guyana. So I represent the academic institution.
Thank you so much, Dr. Cummings. We are still taking roll call from member states, so we move forward with St. Lucia. Is there any representative from St. Lucia? St. Vincent and the Grenadines? Suriname?
Marisha Williams, Suriname.
Welcome. Trinidad and Tobago?
Hi, good morning. Stephen Boudram, Trinidad and Tobago.
Okay, so we move to British Virgin Islands, Cayman Islands, Turks and Caicos. I don't know if there's anyone from Anguilla or Bermuda. Okay, having completed the member states, we move forward to the organizations. Is there any representative from CARFO?
Hi, good morning. Mark Sami, Director of Corporate Services, present. Good to see you again, Dr. Bender-Pelswick.
Yes, good to see you too, Dr. Sami, and welcome.
Thanks.
PAHO WHO, I know that we have an extensive team. Dr. Bolastig, I don't know if you will lead the introduction.
Yes, thank you very much, Serena. Edwin Bolastig, HRH Sub-Regional Advisor based in the Sub-Regional Program Coordination in Barbados. I have my colleagues with me. Would you please present yourself, Fiona and Maria Ellen?
Good morning, Fiona Harris Glenville, IPC, working with the Caribbean Node of the Virtual Campus for Public Health. Pleasure to be here.
Good morning, I am Maria Elena Larcon. I'm working as a consultant for PAHO for the policy brief that we'll be presenting today.
Thank you so much, PAHO WHO. Do we have a representative from the University of the West Indies?
Before we
yeah,
I'm from WHO, so
I'm sorry.
WHO headquarters is fine. WHO headquarters, so I'm Juana Paula Bustamante, I'm labor economist, Geneva headquarters.
Welcome.
Thank you.
Are there any other participants from PAHO WHO?
I believe that will be all for now. Benjamin will try to join shortly. He's in our HSS retreat at the moment, but he signaled to me that he'll be joining at a later time.
Thank you so much, Dr. Steek. So we move forward. Do we have a representative from the University of the West Indies?
Yes, Professor Julie Meeks here, joining.
Welcome.
Thank you.
I believe Dr. Emmanuel Cummins already identified himself for the University of the West Indies. Welcome, Doctor.
No,
We
he's from
move.
the University of
University of Guyana. My apologies. We move forward with the Dalhousie University. My apologies. Is there any representative from Dalhousie University?
Good morning. Yes, I'm representing Dr. Gail Tomlin Murphy, who is out ill today. Thank you.
Welcome. Thank you. Is there any representative from the regional nursing body?
Good morning. I am Nesta Edwards, and I am representing the regional nursing body.
Welcome again, Chair. We would have also received acknowledgement or presence from Dr. Juana Bustamante from the WHO. So we acknowledge her presence. On the CARICOM Secretariat side, we do have an extensive team with us this morning. Director, I don't know if you will introduce yourself or would you let me to?
Good morning. And I'm Director of Human Development. Happy to be with you this morning. And I wish us all the best for the entire day. Thank you.
Good morning again, everyone. My name is Tamara Bob. I'm Program Manager, Health Sector Development.
Good morning. My name is Cheryl Collins, and I'm Administrative Assistant, Health Sector Development at CARICOM Secretariat.
And well, I am Dr. Serena Bender-Pelswick, Deputy Program Manager, Health Sector Development. I believe we also have online our admin support staff that are from IT, as well as other admin staff. So welcome, and I hand the floor over to Director for opening remarks.
Before the opening remarks, thank you very much, Dr. Bender. We need to ascertain whether we have a quorum. I think based on my quick review, I don't think we have 8 member states represented. How many do we have?
Sorry.
We have only
one more, 4.
Good morning.
I was having some difficulties with my constant and think it's an invest.
Good morning.
Good morning. We are not hearing clearly on our end.
Okay. St. Kitts and Nevis is present. Fishma Cranston.
Okay, thank you.
Good morning.
Okay.
Good morning. Who is speaking? Wilma, could you identify yourself?
Wilma Ryan from St. Vincent and the Grenadines.
Okay, thank you.
So, Dr. Bender, that makes it how many member states represented?
Yeah, 7.
At this point, Director, it looks like about 5 or 6 member states. We have, and please, participants, please correct me if I'm wrong. I believe we have Barbados, Belize, Dominica is here, Grenada, St. Kitts and Nevis, St. Vincent and the Grenadines just joined, Suriname is here, Trinidad is here. 1, 2, 3, 4, 5, 6. We have 7 member states online currently.
So that means to say we are still missing one to be corrected. Do we want to give at least 5 minutes? I don't know if anybody knows a member state that is intended to attend? Do we have any country that indicated that they would attend and they're not in?
I believe the
Enrica.
Bahamas did.
Is Guyana
Um,
here? I think Guyana was expected. Is Guyana here?
Yes, sorry, Dr. Bendapes, I didn't hear you call TCI.
TCI is here. Well, then that would make it
Yes.
8. My apologies. And I see
No,
CMO.
doctor. Yeah, but doctor, this is a associated member,
Member
so we are
state,
waiting
okay.
for one member state. I was
Okay.
just following on Guyana. Do we have?
We don't see anyone online from Guyana at the moment.
Do you have any number? I just want if somebody could just sign. Otherwise, the meeting will be.
All right, let me see if I can make contact.
So
I
okay,
would
just give
suggest
us
perhaps we
2
allow 5 more
minutes.
minutes. Sorry,
Okay.
Director.
Okay.
I'm seeing Dr. Keyser Beach's hand is up.
Hi, good morning. Can I go ahead? Just make a comment, please.
Yes, please proceed.
Okay, I think there's a little problem because the other meeting, all of us were on the other meeting to look at the draft for the revision of the treaty in terms of access to healthcare and what that means. So there might be a little challenge for some persons who should be on this. So for Bahamas, I know CMO wasn't there, somebody else was sitting in for her. And I know Guyana's CMO, I'm not sure who their rep is, but they were on that meeting. So just wanted to point that out, that I think there might be a little challenge somewhere for some places that have the same persons represented. All right, thank you.
Thank you, Doctor.
Thank you. It's not on. So thanks.
Director, I note Jacqueline Sutton has joined. Could you say which member state you're representing?
She's Turks and
Oh, that's Turks and Caicos. My apologies. I also see Margaret Smith has joined. CNO
Caicos.
Smith, please confirm that you
For
represent.
those persons who just joined, kindly indicate which country you're representing or organization. Thank you.
Morning, Margaret Smith, CNO Antigua and Barbuda, Ministry of Health. Good morning, everyone. Thank you.
I believe, Director, with Ms. Smith's entry, that would make us correct.
Yes, thank you so much.
Good morning,
so-
everyone. Yes. This is Terry Raffalia, Ministry of Health, alternate for Dominica. Thank you.
Thank you and welcome.
Okay,
Thank you,
thank you
Mrs.
all.
Reed.
So we have a quorum of 8 members, and so I now hand you over to Mrs. Helen Royer, Director of Human Development, to bring welcome remarks.
Thank you very much. I think we expect the Honorable Dr. Frank Anthony, but I'm not sure he's on this morning. But I would like to welcome him if he's here. Dr. Benjamin Prautas, Unit Chief, Human Resources for Health, Washington. Dr. Edwin Bolastic, Sub-Regional Advisor, Human Resources for Health, PAHO. Members of the Human Resources for Health Caribbean Commission representing member states, partner agencies, and regional institutions. Good morning. On behalf of the Secretary General of the CARICOM community, Dr. Carla Barnett, I welcome you to the 6th meeting of the Caribbean Commission for Human Resources for Health. Being the first meeting for the year 2024, the Secretariat takes the opportunity to recognize the gains that have been made in the past year. These now serve as the foundation upon which the Commission will continue to build in 2024 addressing challenges faced with training, recruitment, and retention of human resources for health. We are very honored to be graced with the presence of the Honorable Minister if he is here with us, and this would attest to the commitment that even at the policy level, we have support for this issue. We'll be pleased to receive any advice if he's with us today. And I'm very sure that based on the previous meetings we have been having, that our ministers are very keen on moving forward with the policy for addressing human resources for health. The establishment of the Human Resources Action Task Force was mandated, as you know, by the 36th meeting of the Council of Human and Social Development in November 2020. However, the vision and circumstances propelling the need to address the region's human resources for health and journey to do so began as far back as 2001. And this is when the Ministers of Health in the NASA Declaration on Health proclaimed the health of the region, the wealth of the region. The relevance of this body resulted in the endorsement for the establishment of the task force as a permanent commission by COSOD in 2022. We are aware that the health of the region's people, now as then, depends on the availability, accessibility, and capacity of health systems of health and the healthcare force to deliver quality, centered, affordable, integrated care, in short, achieving universal access and universal health coverage. In today's meeting, we will seek to address these issues by working towards a policy proposal, together with partners that are drafted by PAO, together with partners, and the updates will be provided on the policy brief on the mobility of healthcare workers in the region and the systematization of the work of the Human Resources for Health Action Task Force. The availability of reliable data remains a pillar of managing and adequately deploying human resources for health. The National Health Workforce account serves as a standardized health workforce information system in the region. Today, member states will report on the progress made in implementing the National Health Workforce accounts at the national level. A number of our member states have made advances in addressing HRH challenges. However, the region's persistent and perennial problem of migration of healthcare workers, and more recently, the COVID-19 pandemic, has severely exacerbated the gaps in availability, distribution, and quality of human resources for health. And it has placed at peril hopes for achieving universal access and universal coverage. We must act now and act together as if this is not done, we will continue to work towards maybe not receiving the desired results. As the CARICOM community moves forward with the work of ensuring the free movement of citizens within the community, keen attention should now be paid to the development of policies that promote the free movement of healthcare workers within the Caribbean community. These policies must also emphasize the optimization and harmonization of the education of healthcare professionals that is reflective of the current needs of the health system within the region. Furthermore, member states should strive to ensure that safety and well-being of healthcare providers are assured as a means of maintaining a well-equipped and motivated workforce. I would like to recognize the continued partnership of the team at Pan American Health Organization, member states, the representatives from partner organizations and institutions who are also supporting this initiative through technical support. I also wish to acknowledge the national focal points who are supporting the management of human resources for health and spearheading the actions to address the challenges faced at the country level. I extend a hearty welcome to the new points to the Commission. Finally, I recognize the work of the outgoing chairperson, Ms. Lizette Bell, who has skillfully guided the work of the Commission during her tenure. The chairmanship is scheduled to be assumed by the representative of Dominica for the year 2024, and we wish her a successful tenure. I can assure you that the results the region is looking for in real time and real life must be as profound and as life-changing as the impossible missions successfully undertaken by the brave, resourceful, and very committed. So we are all here and we are sure that the mission will be accomplished. In parting, I wish you fruitful deliberations in today's meeting. Thank you.
Thank you, Director, for those remarks. At this time, I will invite Dr. Edwin Bolastig, the Sub-Regional Advisor for Health, PAHO WHO, to bring brief remarks.
Thank you, Tamara, and thanks to the director as well for her remarks. All protocols having been observed, Dr. Royer, or colleagues, good morning. On behalf of the Pan American Health Organization and the World Health Organization, we would like to welcome you all to this meeting, the sixth meeting of the HRH Caribbean Commission. At this time, we would really like to thank and congratulate the members of the HRH Caribbean Commission for your commitment and dedication and all of the achievements it has achieved for the past several months. Since its inception as the Action Task Force a couple of years back, and with the formal launch of the Caribbean Commission in November last year, you have done a great deal of work already in addressing major challenges on human resources in the country. I'd like to echo as well the congratulatory note and thanks from Director Royer to the members of this esteemed commission. And looking at the packed agenda that we have, there are very important topics that we'll be addressing, in particular the systematization of the achievements of the HRH Commission or / task force, the policy brief on mobility of health workers. We'll also be discussing important actions on the HRH information system, as well as on nursing education and the upcoming meeting or workshop on health labor market assessment. And so given the agenda that is before us, I would like to wish everyone a very successful meeting, and we would like to invite all our colleagues to please continue to engage and participate actively in the discussions, so that we will reach the goals that we have set for the Caribbean at this time. So thank you all very much, and I welcome you all to this meeting. Over to you, Tamara.
Thank you, Dr. Bolastig. And now I invite our chair to take over at this time. Ms. Bell.
Hi, good morning, everyone. Thank you very much, Dr. Bender. Thank you, Dr. Bolastig, for your opening remarks, and also Mrs. Roye for her welcoming remarks this morning. So as we proceed, also I'd like to welcome each member here today and the different organizations and institutions that are present. It definitely shows the commitment from your end towards the human resources for health. So as we proceed as per the agenda, okay, we have the adoption of the agenda. This morning, we are going to discuss some items in relation to the current activities of the HRH Commission. We will be looking at the reports and decision of the 6th Directing Council presentation. Also, the report on the HRH workshop in Panama, the strengthening of the HRH Caribbean community experience, the nursing education in the Caribbean, and also the work plan for the HRH Commission. And Does anyone have any other business that they would like to add at this point? If not, can two persons kindly accept the agenda as is so we can proceed?
Carper moves to accept the agenda.
Thank you.
I accept the agenda as it
Th-
is.
Thank you very much. Okay, so we'll move to the next item, the procedural matters. We would like to ask members, when you're not speaking, to kindly keep your mics turned off and use the raise hand icon when you have a question. This meeting is scheduled for, I believe, Miss Dr. Bender, is it 2 hours? We should complete by
12, yes,
by
Chair. It
12.
is scheduled for 2 hours, at 12 p.m. Eastern Standard Time.
Yes, thank you very much, Dr. Bender. Okay, and I must say that I believe the next HRH Commission meeting is going to be chaired by Dominica. I hope that the representative is present today. And as we transition into the new chairmanship of the commission, I would like to also thank Dr. Puertas for his support during that time as chairperson, and also the secretariat. They have been very supportive of the commission and the work of the commission. So thank you very much to Dr. Puertas and the CARICOM secretariat. So let's proceed to the item number 6, which is update on the current activities of the HRH Commission. Dr. Polastik, can you kindly proceed?
Thank you very much, Madam Chair. At this point, we're very pleased to share with you some updates on 2 items under agenda item number 6, systematization of the achievements of the HRH ATF/CC, and also the policy brief on mobility of health and migration of health workers in the Caribbean. At this time, I wish to invite my colleague, Dr. Maria Elena Alarcon, to please share updates on the systematization of the achievements of the HRH. And after that will be the presentation and the draft policy brief. Over to you, Maria Elena.
Good morning, everyone. I'm pleased to have the opportunity to meet you all, even through a screen. As Dr. Velasquez said, I will be presenting the policy brief on migration of human resources for health in Caribbean, and also talk a little briefly about the systematization of the work of the Commission. So far, the draft document is completed. It is being reviewed by member staff of PAHO, and we would like also, of course, to circulate this document with all member states of the Commission to have your input and feedback. That is regarding the systematization of the work of the Commission. And I would like now to share the screen for the presentation on the other policy brief. Please let me confirm that you can see the screen.
Yes, we can, Maria Elena.
Let me just go. Okay. So I will be presenting a summary of the draft policy briefs interventions to address migration and mobility of healthcare workers in the Caribbean, with a special emphasis on the training and retention of human resources for health. Here's some background on this work, on the development of this document as a part of the work of the Commission. The first point is the Caribbean Roadmap of Human Resources for Universal Health in 2018-2022, which highlighted the HRH challenges in the region, including the migration of healthcare workers, and it stressed the need to develop strategies for countries with acute shortages and retention strategies for human resources for health. At the 39th meeting of the COSOD in November 2020, CARICOM Secretariat was tasked with collaborative efforts from PAHO to establish the Human Resources for Health Action Task Force to advise on and oversee the development of public policies throughout the Caribbean, addressing critical issues such as healthcare worker shortages and migration, and it was officially launched on April 2021. In September 2022, the COSOD mandated the establishment of the Human Resources for Health Caribbean Commission as a permanent body to build on the successes of the Action Task Force. During the 29th special session in March 2023, the COSOD mandated the Caribbean Commission, with support from PAHO, to develop a policy brief addressing the mobility and migration of nurses and physicians. In September 2023, the Regional Committee of WHO for the Americas approved the policy on the Health Workforce 2030 and urged member states within their individual circumstances to enhance healthcare workers' stability and emphasized the need to mitigate the negative effects of migration. They encouraged the advancement of information systems and the international reporting of labor mobility, aligning with the WHO Global Code of Practice. Here are some key considerations. The growing trend of HRH migration is negatively impacting healthcare quality, timely delivery, and CARICOM's health system sustainability. What available data says regarding the trends of migration is that the main destinations are North America and Europe, being nurses the largest group of health professionals migrating from CARICOM, and that migration flow was exacerbated by the pandemic. The main challenges we found that the region is facing are staff shortages, staff burnout and attrition, brain drain implying limited specialized health professionals. All these predict that the countries of origin from the Caribbean will be facing the impact of the projected deficit of health professionals that by 2030 is projected to be around 2 million in Latin America and Caribbean. Another important challenge is the recruitment strategies from destination countries, and also the lack of data for human resources for health planning, and of course for decision-making processes. All this highlights the need to address human resources for health, mobility, and migration in the region, particularly in countries with low density of health professionals and high rates of migration. Here are some slides of recent data from OECD of migration trends in CARICOM. Here we can see the period in the period 2015 to 2016 that OECD countries with the most Caribbean trained doctors were US, Canada, and UK. Most of these professionals came from Grenada and Dominica. In the period 2017-2021, OECD countries with the most Caribbean trained doctors are New Zealand, Canada, and United Kingdom. But for this period, there is no data available for the United States, and most professionals came from Grenada, St. Kitts and Nevis, and Jamaica. Here we can see that from 2015 to 2020, about 30% of all foreign trained doctors in the United States are Caribbean trained. And this last slide shows that from 2015 to 2021, most Caribbean trained nurses in the UK and Canada are from Jamaica, Guyana, and Trinidad and Tobago. To generate recommendations for the policy brief, we reviewed the drivers for migration. A survey conducted by PAHO in 2018 showed that the main reason for healthcare professionals to migrate are, in first place, better working employment conditions abroad, followed by better financial economic opportunities and education and training opportunities. For the aim of this policy brief, we consulted stakeholders about the factors they consider are driving health professionals to migrate. And from those who provided their inputs, the reasons were similar to the survey in 2018. Better salary and benefits abroad, lack of career advancement opportunities at home country, poor working conditions at home country, better quality of life abroad, and also the recruitment strategies used by destination countries and work overload at home country. Here we can see that these four main factors are contained by the three main drivers in the survey. So they are similar. Previous studies show similar findings and also evidence that existing social networks within the diaspora significantly influence migration decisions, directing the flow of migration. Here is a summary table of the push and pull factors identified from literature and the consultation to stakeholders as those that influence the migration health professionals in the region. The primary push factors influencing healthcare professional migrations are also a reflection of the prevailing socioeconomic and political landscape in the region. As push factors, we have stressful, unfavorable, unsafe working conditions, inadequate remuneration and benefits, limited professional development opportunities, excessive bureaucracy, lack of management and leadership, underutilization of skills, burnout due to increased workload, lack of professional recognition, lack of respect for health workers and the profession, and as pull factors, it was identified better working employment conditions, better financial opportunities, remuneration and benefits, opportunities for education and training, professional growth, career advancement, modern human resources management, professional recognition, more interesting work, financial support for registration and immigration for foreign employers, overall improved quality of life for themselves and their families, recruitment tactics used by foreign institutions, and also speaking the same language as my destination countries. The diasporas were identified in both. So here's the proposal, the policy recommendation that entails some interventions to address migration and mobility of health professionals in CARICOM. The first one is to prioritize the collection, utilization, and reporting of up-to-date data. This was identified as an important challenge to address the data. The recommendation is to report the WHO Code of Practice and to conduct health labor market analysis. All this integrated to the National Health Worker accounts that there are some core indicators were already identified for the region. That was part of the work of this commission. The second intervention is to implement competitive salaries, benefit, and career growth opportunities. For this recommendation, we have two aspects: to conduct benchmarking of wages within CARICOM member states, national, international, and regional. And when saying national, we mean in private versus public sector, because the mobility is in there too. And also to implement career pathways that are integrated in these improved compensation packages. The third recommendation is to strengthen training programs to implement with three key perspectives: implement micro-credentials programs, implement interprofessional training, establish learning pathways according to local priorities, and it is very important that it is integrated in the career pathways and improved compensation packages that are in the first intervention. The fourth intervention is to work on improving working conditions to enhance job satisfaction and promote mental health well-being among healthcare workers. The fifth intervention is to promote return migration. The sixth one is establish regional and international collaboration. All of these will enable health authorities to strengthen governance within the health systems, and in terms of migration, it cannot be implemented without a multi-sectoral approach, as the interventions and data needed extend across various sectors beyond the health sector, especially for these specific recommendations, education, labor, and finance. Here we have some more detail for each intervention. The first one regarding the collection, utilization, and reporting of up-to-date data has to do with implementing health labor market analysis to assess supply, demand, and distribution of healthcare workers and the factors that influence these dynamics, including data on mobility and migration of health professionals. And this integrated with national health workers account indicators that are completely aligned with the health labor market analysis. All these as inputs for HRH planning and decision-making. The other aspect is to report to the WHO Code of Practice. We're recommending active participation to enable collaborative navigation of ethical recruitment and policy formulation, and to ensure that data standardization and accuracy to support global efforts in managing health workforce mobility. The second one, implement competitive salaries, benefits, and career growth opportunities for human resources for health. We are recommended to reevaluate compensation packages based on these benchmarks, national, private versus public sector, regional, and international data. All these considering the cost of living of each country, and commit to periodic reviews of this information. And then also align the career pathways with the improved or reviewed compensation packages, offering clear progression for strategic integration. Regarding the strengthened training programs for human resources for health, the three key perspectives are the development of tailored learning pathways for career advancement, micro-credentials to enhance skills and recognition, and interprofessional training to foster collaboration and improving patient care. Also, this will be addressing HRH shortages, and it is very important to consider that these key perspectives in training program strengthening should be also aligned to career pathways and compensation packages. The fourth one, to promote return migration, we recommend data collection about health workers and students in main recipient or countries of destination to address push factors and streamline reintegration processes by offering attractive yet realistic incentives that have this intervention has been successful in other countries, offering health professionals some incentives that can be done through the work with other sectors to offer them attractive incentives to return to the country of origin, and foster collaboration locally and internationally by engaging what I just said, key sectors. The fifth one is improve working conditions, enhance job satisfaction by adopting tailored non-financial incentives based on health professional perspectives. This can be done through satisfaction surveys and also with information that we will get from the health labor market analysis, and the measures and interventions to support mental health among healthcare workers. And regarding the establishment of regional and international collaboration to address common challenges, share best practices, engage destination countries, and collectively advocate for ethical recruitment practices. and international collaboration to ensure that international recruitment occurs through government-to-government agreements, and the destination countries to provide technical and financial support. This is also important because, as we know, the financial support and technical support from destination countries would be key in implementing the other interventions that we are recommending. Finally, the policy brief has some core considerations, such as what I said about the multi-sectoral approach to advocate for a holistic whole of government perspective, considering the socioeconomic context and emphasizing policy coherence and collaboration among sectors to achieve comprehensive solutions. As I said, finance, labor, and education are key sectors to work with. The other consideration is the stakeholder engagement, minimize challenges, competing priorities by aligning interests, supporting engagement, and creating collaborative networks. Then financial strategies to explore alternative funding approaches, tap into existing resources, and leverage international cooperation. Unified advocacy, presenting a unified front in international forums to advocate for ethical recruitment and financial cooperation, enhancing diplomatic power. Enabling legislation, we know that all these interventions has to be, the legislation has to be reviewed. So establish tailored legislation, balancing short-term actions with long-term reforms, addressing regulatory gaps and enhancing stakeholder understanding. And monitoring and evaluation, it is important to establish comprehensive framework for documentation, monitoring, and evaluation, ensuring transparency, accountability, and adaptability. Finally, the concluding thought is that CARICOM member states should work towards creating conditions where migration is not born out of necessity due to poor working conditions or lack of opportunities at home, but is rather a choice for personal and professional development within a well-managed and negotiated migration framework, and with the option of return and reintegration into domestic health systems. Right now, I know that the document is being circulated among member states, and we would like to get as much feedback as we can so we can continue to work on this draft policy. Thank you so much, and over to you, Dr. Velasquez.
Thank you very much, Maria Elena, for such a very comprehensive presentation. We'd like to invite our colleagues to share their thoughts about it. And I also would like to acknowledge the presence of Dr. Benjamin Puertas, our HRH unit chief at Washington, D.C., who has joined us, as he would have indicated earlier. Benjamin, we're seeing you, but you are muted.
Thank you very much, Bolastic, and good morning to everyone. As probably you mentioned, we are in the HSS retreat. So I wanted to make sure that I participate partially initially.
We are not hearing you, Dr. Puertas.
Is it better?
Yes, now we can hear you.
I think the presentation of the policy brief draft has been very important to be able to share with the delegates. And most important is to listen to their comments, suggestions. I think we can take advantage of this meeting of the commission to start doing this validation of the information presented by our consultant, Dr. Marilena Alarcón, and be able to consolidate the document that we can start sharing with other colleagues from CARICOM and the countries in the Caribbean, to be able to have a document that is ready to be presented to ministers of health and other authorities in the Caribbean. So thank you very much again. And please count with the Pan American Health Organization for the continued support in these areas of particular interest in human resources for health for our organization as well as for the continent. So over to you.
Yes,
Very
thank you very much, Dr. Puertas, for your intervention. And we'd like to thank Maria Elena as well for her presentation. I am sure that many of what was presented are key recommendations that came out of many of the different consultations and the different surveys that took place within the Caribbean region. I am glad to see that the policy looks at both perspective, looking at how we can even implement strategies for those who have left for them to return back to the country. So I am pleased to see that the policy brief is looking at it from a holistic approach and looking at it from a perspective of regional support and advocacy, as well as country interventions that will help to improve the issue of migration. I see that Dr. Emmanuel Cummings had his hand up. Please proceed, Dr. Cummings.
Thank you very much, Chair and Marinella, for that very descriptive presentation. I think, and I'm happy that the main focus are on solutions, because I do think that we are well aware, because this has been an old age issue. But I just wanted to add that what has happened recently is not just migration of the nurses, but their entire families. And particularly, I know in the UK, from Guyana, a lot of the nurses and they take their children and everyone else. So the burden is not just the healthcare workers, but also the overall population of the region is going to be depleted because of this. They're carrying their children, and these children would have been future healthcare workers. And so as part of our recommendation, I would wish that we also take that on board and look at a holistic, you mentioned holistic approach, but how are we going to ask these persons to return, their entire families and everything else? I think that should be part of how we address. But I do think that in sort of incentives, sometimes, the question I would want to ask, what sort of incentives can we have that can actually compete with those incentives to which our healthcare workers are exposed to in the US and Europe? I know in Guyana, one of the things and our approach, even though it may have a regional approach, there might be specifics per country, and I think I already heard that comment. For example, in Guyana, some of the things which I know the government is engaging, because we have a big housing drive that is going on. And a lot of persons are coming back because they might have left here, they didn't own properties, but now they're coming back because they have access to land, they got a title, they got a house, and sometimes, so, and that is one of the incentives. I'm not a Guyana representative, I'm purely speaking here from a university perspective, but because I'm aware of some of the national efforts, but I would wish that should really come from the Guyana representative. But I know for a fact that is one of the things which, and so maybe we need to think of other incentives apart, other holistic incentives that can be so attractive, that can allow, that would encourage rather some of these persons to return to the homeland. And the other thing, do we have any information? Because this is from an economic standpoint, and this has been one of the arguments. I don't know, it's part of our remit, you hear oftentimes they speak about remittances and the benefit these nurses, healthcare workers are going, but they do remit um, a significant amount of money to the region. And how does the region benefit from that? If that data is also useful, it might be useful, even though it's not something that because it does benefit the region, and somehow it can have some kind of consequences with respect to the kind of recommendation that we wish to make. Thank you very much.
Thank you, Professor Cummings. Any other comments? Please proceed, Maria Elena.
Thank you, Madam Chair. I just want you all to know that I'm taking notes of all the feedback, and thank you for the comments regarding the return of migration. Some of the interventions of the incentives offered are described in the document that can be done with the current resources that are. I would like all the participants to review them. There are some that can be done from the minister in working with other sectors. And also regarding the remittances and the impact, I think that there is information about from the financial sector of the remittances, that's why it's so important to work multi-sectoral. But I think that it's also very important not only to have the data of how much the training of these professionals have cost to the region, but also what is the impact of them leaving, that it's not just the cost of the training. So having that information, it's also very important because we will be able to compare remittances and the impact, how much is the impact of them leaving. It's not only how much is the training that costs, it's the impact on the health system. That would be very interesting to have. And that goes back to the importance of having data to make decisions. Thank you. Over to you, Madam Chair.
Yes, thank you very much, Maria Elena. We have Juana Paula also had her hand up. Please proceed.
Thank you, Chair. Thank you very much for the policy brief. I have just two remarks. Maybe when you send it after the meeting, we can provide detailed comments to the text or something. First is with respect to implement competitive salaries, benefits, and career opportunities for health workforce. So there, what I was thinking of is, okay, what kind of information the country would need actually, right? And it's a way of thinking like, yes, we need to understand the salaries. We need to understand how the health workers are being paid, and therefore the sources and the budget, right? So the part of budget, I didn't see it there clearly, but the thing is like, we would need to understand the salaries, the level of remuneration, including salaries and other additional financial, non-financial topics, but also the budget. Because in some of the countries, it would be most of it from public budget. In other would be some public and some private. And we need to understand it in order to do the advocacy and in order to understand what's the difference in the contracts, right? So, of course, we cannot do it all. And but it would be nice to include it as a budget. And maybe in the way forward is to identify which areas or which professions are we going to look at more in depth. So, and that we can look at. The other thing that I saw really quickly again, because I haven't read it in detail, and it's about intervention 3 on strengthen training programs, right? So I was wondering, okay, shall we think of only about training, or is it education and training, right? Because if we are thinking about career path, if we're thinking about education path, then we're thinking about education, education and maybe continuing training. So, and in that area, what I'm thinking is, okay, we have to start, like, is there something behind education that is signaling doctors or nurses to study or to go towards certain areas? Is the government financing the positions? What are they thinking into the future? Because in the region, we have certain countries that are thinking, okay, we want to actually invite young population to study, but to study to go where, right? So we have to open the discussion on that one, and we have to understand what is being financed by the countries and what is the policy towards those seats in education. So these are two things that I look at when I look at improving working conditions as well. I was wondering, okay, shall we put types of contract in remuneration or in working conditions? But then we can talk about it in another moment. But then it's about, okay, at what point do we enter into contract? Contract types, right? Thinking about what it was said at the beginning on learning lessons from COVID-19, one of the topics that came out from the case studies in the Caribbean was that there were many health workers volunteering, which is normal for the profession for 1 month, maybe 2 months, but they were volunteering for a whole year or for 6 months, right? So the types of contracts, the types of, where do we put them? So those are a few comments. Thank you.
Thank you, Ana Paula. Professor Cummings, I think that's a legacy hand from previous, or you have another comment?
Well, my hand was still up, but I can just make one other comment if I can.
Sure.
In the era of online education, and these are some of the things which we would have done at the University of Guyana. There are many of our graduates, would have migrated, and they wouldn't come back. But what they do, they can still be of use to the institution. They teach online, and so they act as external examiners. So even from a training perspective, where they may not come back, but we still engage them, and that is because education has taken a new perspective now online, and so they can still be involved in training of the next generation of healthcare workers, and so that, to my mind, is something which we can see how we can formalize it across the region. Of course, the ideal thing is to have them to come back. But for those that may not to come back, maybe that's another strategy, I think, which we can use, where we can have them, and that's slowly because of online education. They can still be of some use. I just thought about how useful that can be. Yeah.
Thank you, Professor Cummings. Is there any other comment, any response? Okay. Thank you very much, Maria Elena. And so, Dr. Bolastic, the draft policy brief will be sent to member states for additional comments, or how are we going to proceed with finalizing the policy brief?
Yes, Madam Chair. Thank you very much for giving me the floor. And I believe that the draft policy brief for feedback has already been circulated by CARICOM. Thank you very much to the CARICOM Secretariat for doing that. I believe that the presentation has also been shared. So we look forward to receiving inputs, comments, edits from our delegates to this meeting, as we prepare for another round of presentation of the same policy brief to the CMOs in a meeting, another CARICOM meeting for the CMOs in April in St. Lucia. So we hope that before then we would have received your inputs and then eventually it will go up to COSOD for acceptance and presentation. I'm seeing Benjamin's hand as well, Madam Chair.
If I
Yes, kindly proceed, Dr. Puertas.
Thank you very much, Madam Chair. I just wanted to make sure also that CARICOM and asking if they have shared the policy brief with the institutions, because as I recall, the HRH Caribbean Commission has official delegates from the countries, but also we have institutions that have been participating since day one in the task force first and then the commission. So I think it's important also to share the document with those institutions here. We have CARPA, WHO, Dalhousie, we have RNB, we have PAHO, of course, well. So I think that that's important to receive also their feedback. And secondly, I want to emphasize the fact that during the last COSOT, the ministers of health are the ones who mandated CARICOM, the Caribbean Commission, and PAHO to prepare this policy brief. So I really want to emphasize on this fact because it came from the highest health authorities in our region. So I'm talking about the Caribbean. So I think it's really important that everybody engaged in this, in providing their comments, because when we present this policy brief, it's going to be the HRH Commission work. It's not going to say this or X agency or this or X country. So I think it's important to have the best policy brief that we can really manage to compile and consolidate, and so we can present this with Ms. Bell and with the colleagues. We have been discussing the importance of going even up to the highest level, which is heads of state. As you remember, Ms. Bell, in the past, we were able to put one of the policy briefs elaborated and validated by the Commission all the way up to the heads of the state. I'm talking about the vaccine hesitancy draft. So I think this is a really relevant and important document to go all the way up. So all the inputs, comments, suggestions that you can come out and I want to emphasize the fact that we have here very, very relevant authorities and people who understand, who suffer the situation of migration, especially of nurses in the Caribbean, who can provide very, very important feedback on especially the policy actions related to the policy. So I wanted to just say that, Madam Chair, and over to you. Thank you very much.
Thank you very much, Dr. Puertas, and I totally agree with you. I think this particular policy brief, based on the critical nature of the topic and how it is shaping health system in the Caribbean region and access to health services, I think we definitely have to ensure that it reaches to that global ministerial level. So thank you very much, Dr. Puertas. We have a hand up here from Ms. Shana McKin, and then we will proceed to the following item. Ms. McKin. Okay, she did not respond. We have the CARICOM Secretariat. Please.
Thank you very much, Dr. Puertas, and thank you, Chair. Are you hearing me?
Proceed.
Are you
CARICOM
hearing me?
Secretariat.
Are you hearing us?
Yes, we can.
Doctor. Yes, Mrs.
Okay.
Yes, Mrs. Roy,
Okay.
please proceed. We're hearing
All
you.
right. I was
Thanks.
just saying thank you very much, Dr. Puertas, for your presentation and for Pao's presentation, and more so for having been coordinating that effort. I think you requested, you asked whether we had circulated the policy. We did. And also to inform that you would have realized that migration is not only an issue for health. So what we have been doing, even within the directorate, we met with our staff yesterday, and a number of issues were raised as it relates to the impact of migration on crime and security, on health, on gender, on youth development, on education. So what we are intending to do, although we know that it is not a generic migration policy, we will be looking at it in the context of the impact on education, especially the cross-cutting areas in our directorate. I hope we are not too late to do that. And as you said, we will be also taking it to our chief medical officers. But I think based on what is coming out from all angles, at some point in time, we have to look at an overarching policy that would address all the different areas, because what is happening in health is also happening in education, and we have the youth being affected. And so we are looking for maybe a more fulsome discussion on a generic policy, but we will look at the document that you sent in light of the impact on the different cross-cutting areas in our directorate. Thank you very much.
Thank you. Thank you, Mrs. Roy, for your comments. Okay, so thank you all for the discussion surrounding the policy brief on mobility of healthcare workers. And so now we proceed to item 7 on the agenda, the HRH Health Information System. Dr. Bolastic.
Yes, thank you very much for that. We just would like to actually revisit the draft document that has been developed in the past, because we find as based on the presentation from Maria Elena, data is very important, and as supported as well by Juana Paula, data in terms of for policy and decision making is very, very important, particularly in this case for human resources for health. And so there's been a draft action framework that has been drafted in the past, but I believe because of the pandemic and other intervening factors as well, the timeline has moved, but some of the actions have not been enacted. So I believe it's important that we take a second look at that. And maybe if I could if I would be able to share my screen quickly, is just to share what has been enshrined in the document. Please bear with me for a moment. Let me just right. I don't know if you're seeing the document itself.
Yes.
Okay, so you will see here there's been work already jointly between PAHU, the HRH Caribbean Commission, and of course supported by the CARICOM Secretariat on strengthening the strategic information human resources for health in the Caribbean community, with the goal of strengthening evidence-informed decision-making and policy development on HRH in the sub-region. With the following objectives: to improve data collection, analysis, and reporting on the HRH core indicators for the Caribbean, and to strengthen and sustain the availability and use of strategic information on human resources for health in the Caribbean. The document, as you would see, has tabulated the priority area, the actions, the lead responsible agency or member state or actor, and the timelines. And you would see that most of the timelines have actually passed. And so it's important that we review what was planned in this framework and maybe revisit how we could reactivate work in this area. And so some of the priority areas are improved governance for HRH, strengthened national and regional capacity, strengthened information management systems for HRH, and improved dissemination and use of strategic information for decision making, and improved budgeting for HRH. Again, as you can see, that some of the timelines have passed, and so and some of the timelines as well have not been determined. So we'd like to bring for your consideration what your thoughts are in terms of reviving this initiative. Over to you, Madam Chair.
Thank you, Dr. Pertes, for the update in regards to the strategic information on human resources and the action plan. Is there any comments or question in relation to this item?
Let me add as well that
Sure, Doc.
okay, in the meeting in Panama, there's been some workshops there and activities that would have helped, consolidate some of these efforts. And I know that a number of countries have committed to actually, work on the area of HRH information system, including requests for training on HRH and technical cooperation on in HRH information system. I was also informed that as of date, there are already 18 Caribbean countries that have been reporting to different levels of compliance with the National Health Workforce Account. So thank you very much for all your efforts. But in terms of, I think, comprehensiveness and completion of the information that is being required, we still have ways to go there, but would like to thank you for your initiative in starting to build the information on the National Health Workforce.
Yes, Dr. Bolastic, I think that as member states, I think we note the importance of data for informed decision making and especially for the development of the strategies and policies surrounding HRH. The workshop in Panama did provide some important support and guideline to member states on how to use the tool really and how you can able to extract information for your own reporting and how you can align it with your own country indicators and your country data, because it's not really just for us to report to PAHO WHO, but it's for us to use this information within our own countries to inform how we, the framework for HRH and how we move forward with human resources for health. Is there any country who would like to comment on their experience with the HRH health information system after the workshop? Also, the member states can also use this forum for them to identify if they need additional support in helping them with their health information system for human resources for health. So if you all would need any additional support or training, I know that there was an option at the workshop to indicate so, but if your country did not participate, then you can also indicate that to us and here in this meeting, and we can see how we could forward the request for the support that you may need. I see CNO Smith. Please proceed, CNO.
Thank you. Good morning, Chair, and thank you for allowing me to make these comments. And thank you, Dr. Bolastic, for this presentation. I'm just wondering if this document has been disseminated, if member states already have access to this document, and this is the first time I'm seeing it. I did not. I, who have been the NHWA focal point for some time, might have been given the opportunity, but at the last minute, my ministry decided to send someone else. And so it was agreed that that individual would assume the focal point with responsibility to, to manage the issues in relation to HRH and the National Health Workforce account. I don't see this person on the, at the meeting at this time. And I was just wondering if you, Chair, would be aware that there is a new person with responsibility for the NHWA for Antigua and Barbuda, and whether communication was sent. I looked at the first priority area. If you could just scroll down a little bit, Dr. Bolastig, realizing that you were recommending that there be 3 persons, nominate 3 points to be assigned to the NHWA, and having a multidisciplinary team, and I'm all for that, the multidisciplinary national team. And so therefore I thought that I could have, having been there before, could have been partnering with the new team, individual or team, to ensure that at least for when it comes to data for nursing, that we are kept up to speed with inputting that data. So I'm going to be seeking to speak with that individual and see how we could improve that governance as far as we are concerned here in Antigua and Barbuda, and for me to get back in that team to ensure that we are really updating our data health workforce on a whole, but I'm particularly concerned about data in relation to nursing and midwifery in my country. Thank you very much.
Thank you very much, CNO Smith. The Secretariat did send out formal correspondence to countries to kindly indicate who their focal points would be for HRH and for the commission, and also an alternate. So I am not sure who was the persons who have been nominated from your country, but the Secretariat did complete that task, I think a few weeks ago, and had requested that from all member states. I think Dr. Bender would be able to update us if we got in response from all the member states. And if we could kindly have this part of the strategic plan shared with us, Dr. Bolastig, it would be very good, because I can see some of the items that, well, I see one of them that had a time frame, and so probably we need to update it, and it could probably be added to or tied into the HRH Caribbean roadmap, as I see here in item 10. Okay, so thank you very much, Dr. Bolastig, for your presentation. Dr. Bender, do we have the presentation from the Bahamas this morning?
Hello, Chair. As far as I'm aware, we should, but I think they can project because we do not have it on hand at the moment. Is the representative from
any of
Bahamas
you would
here?
be informed if we have the Yes, Dr. Bender, do we have the item 8, the presentation from the Bahamas, the country experience?
No, we have not received that. So
Okay, so we defer to the next commission meeting. Now we proceed to item 9, strengthening nursing education in the Caribbean. I think this is going to be presented between PAHO and our chair of the regional nursing body.
Thank you very much.
Chair of the regional nursing body, or Dr. Balasne.
Thank you very much, Madam Chair, for your giving us the floor. I really would like to give the floor and invite the chair of the RNB to provide some of the updates on these topics. I believe that has been a very, very successful meeting wherein these topics were discussed. And so it would be great if our RNB chair would be able to share these updates with us.
Sorry, CNO Edwards, Chair of the RNB. I see CNO Edwards connected. Okay, so until
Maybe I could step in at this time while
yes, please,
uh,
while we
while
get
the chair is able to connect. She might be having some technical issues there. But just to say that in terms of the expanding roles, education, and regulation of nurses and primary healthcare in the Caribbean meeting in Chicago, there have been a lot of topics that were covered in these particular areas. A report that has actually been generated and is being finalized for circulation and for publication. And it has also been through this meeting, we've been able to identify areas for technical cooperation. And so we would in once we are able to provide collate all of the updates on the status of this technical cooperation request, we'll be continually sharing this information. But this meeting in Chicago has been very instrumental and in bringing together all the different players and bringing together different actors and also consolidating what are some of those areas that would require intervention in HRH. PAHO WHO stands ready in responding to these requests. At this time, we are working with several countries in developing or updating their HRH Caribbean their HRH policies and plans among the Caribbean countries. Belize, for instance, we have received the terms of reference for circulation for hiring of a consultant for the updating of its HRH policy and plan. Also from Suriname, we will be expecting, and there are countries that are currently developing their plans, such as Barbados, Jamaica, St. Vincent and the Grenadines. We're working with them as well in updating the draft that they have. And so there's been a lot of movement in terms of either updating, developing, or requesting technical cooperation for HRH policy development. So this is one area of work that we're working on. The other one is on HRH information systems. So that we are actually, working with several countries in terms of helping them in terms of building the capacity for the collection and analysis of information system, which is very, very important, particularly towards later in the agenda. We'll be discussing the health labor market analysis, which will require a lot of information from the different countries to be able to do that kind of analysis. And so in terms of the midwifery education and regulation in the Caribbean, we have received the request from the last RNB meeting for PAHO to support that. At the moment, we are asking the CLAP, or the PAHO Center for Perinatology and Women's Health, to review the terms of reference prior to its circulation, and also to share it with CARICOM for the formal process for the request from PAHO, right? So we are in that situation right now. And I'm not sure if RNB chair is available right now to discuss the other R&B initiatives that we're working on together, as discussed during the meeting in Guyana last week.
Yes, thank you very much, Dr. Balastic, for your update in relation to the workshop and the different technical cooperation requests that you have received from member states. The chair of the R&B, CNO Edwards, can you kindly proceed? CNO Edwards, chair of the R&B. I know that her mic is open, but
Madam Chair, perhaps we could revisit that and move on to.
yes. Sure, we'll definitely have to revisit that particular item. And then we can now proceed to item 10.
Mhm.
The face-to-face HRH commission meeting to look at the issue of the health labor market assessment and also the development of the Caribbean roadmap the HRH Caribbean roadmap. So Dr. Bolastic, can you kindly present on this item number 10? Thank you.
Okay, thank you, Madam Chair, and we're very, very happy to share with you that we are now in the process of preparing for the health labor market analysis jointly with our colleagues from WHO. And I'm glad that Juana Paula is with us today because we've been working very, very closely with her. And of course, our also our PAHO team as well, both at the different levels of the organization. This is an example of the one PAHO and WHO organization working together. So we have Juana Paula from WHO. We have Benjamin and Hernan Sepulveda from HQ. At the sub-regional level, that's me, and then at the country level, we have the PWR in Trinidad and Tobago, and the HSS advisor working with us as well in preparation for the face-to-face portion of the blended health labor market analysis that we are looking at. So the face-to-face meeting portion of the blended approach, we're hoping that it will happen on the week of the 10th of June. However, there will be 2 virtual sessions that I hope Juana Paula will be able to shed more light on in April and May in the run-up to the health labor market assessment. We're hoping that for this, we would really like for countries, to come out and participate in the process. However, for the face-to-face, we will have to. There will be a set of countries who will have to do the face-to-face together, and then the one that would with the highest possibility of being able to conduct the health labor market analysis as well. This is very, very timely, particularly as we've discussed that a lot of countries now are moving towards either updating or developing their HRH policies and plans, but at the same time as well, in terms of the overall HRH development in the respective countries, that this is going to be very useful, and also in terms of advocating with your respective governments in terms of investments in human resources for health is just this. So this becomes very, very timely for this meeting as well. We hope to have to be able to update the HRH Caribbean roadmap, which would have expired in 2022. And so given the new developments, given COVID and the new developments in the region and globally, there is a need for the Caribbean to have, look towards the future in terms of what are gonna be the new priorities for the next period. And so for this meeting, we would like to be able to update the Caribbean roadmap, which incidentally has also been developed out of a workshop in Trinidad in 2017. So Juana Paula, if you would like to add to what has been mentioned regarding the health labor market assessment, we would be happy to hear from
Thank you. Thank you, Adrian. Yeah, we'll be organizing the blended training in the Caribbean. The first training. This is the first one. It doesn't mean that that is not going to be any more in the future. So the idea is, which would be, as Edwin mentioned, which would be for countries that are ready to doing plans, programs, and they have enough data, information to go for it. The first webinars that we're doing, we find that it's important to do preliminary webinars for this in order to prepare the countries for the on-site. Why? Because the on-site trainings is hands-on data, hands-on analysis, right? And we want the countries to do their analysis with their own information. Yeah. So the two preliminary webinars to start understanding what kind of information do we need? What kind of stakeholders should be joining this? This is not only about Ministry of Health. And inside the Ministry of Health, we might need another colleague that is inside the Ministry of Health that have got some information, some data. So we have to start thinking on that. So that's the idea of these two preliminary things. We are going to link it as well with the migration issue. The migration issue is a key issue together with remuneration and working conditions in the region. So we will have another of these webinars dedicated to this topic to understand how can we start to gather this information so the countries arrive to the on-site training with the part of the information to develop the work. The on-site training is going to be divided in one part is going to be of presentations. So this is about supply of health workers, how many health workers are available in the market, right? And behind it is the labor market. We did a presentation here like a year more longer of a year about the introduction of it and the demand of it. So the positions, the public, the private sector. So we're going to look into it, the dynamics behind it, and then try to link it with policy actions. So everything has to end on how the evidence is analyzed by the country, by different stakeholders, and bring policy actions and link it. So the morning would be like in this kind of theory, and the afternoon would be like how in the country would this look like? So, well, that's a kind of teaser, let's say, of it.
Yeah. Thank you, Juana Paula, for the teaser, as you mentioned. I think we had a brief taste of what to expect, and so we'd like to really engage the countries, but because of logistical reasons and also availability of resources as well, we will have to come up with the criteria for the selection of the countries in terms of those experiencing major HRH challenges, including migration of health workers, the countries that are developing or planning to develop HRA policies and strategic plans, countries that have actually also, as mentioned by Juana Paula, those countries which would have more or less a certain level of information that has been that are available and collected to be able to advance in the analysis. And of course, countries that are actively participating in the HRH Caribbean Commission as well. So we will be probably sending out memos to the country offices to invite the countries who will be participating in the health labor market analysis. Over to you if there are any questions. We're open to respond to them.
Yes, thank you very much, Dr. Balastik and Juana Paula for that presentation and update on the labor market assessment workshop and also tying it with completing the HRH Caribbean roadmap. Is there any questions from any member states or any institutions? Any participants? Okay, if there is no questions in relation to item 10, we note that the chair of the RNB is having some difficulties with her internet, so it seems she will not be able to connect. I see CNO Smith have her hand up. Please proceed, CNO Smith.
Thank you, Madam Chair. I dropped out for a little bit and didn't get everything that was mentioned by the most recent speaker, Juana Paula. And I was just wondering if there was any mention about when this training will take place and who will be considered for participation. I also wanted to, I don't know if Dr. Balestic did respond to my question to his earlier presentation on strengthening strategic information in HRH in the region. I'd wanted to know whether the regional action framework was made available to member states. Thank you. Bye.
Thank you, CNO Smith. Dr. Bolastic, or
Yes, let me first respond to the if the framework has been shared before. I was not in in with my position at that time, but I believe that it's been previously circulated. However, I'm definitely going to reshare it with the CARICOM Secretariat so that that will be circulated, recirculated, and revisited by all the member states that are represented in this meeting.
Thank you. I would appreciate that, Dr. Balestic.
and CNO Smith, with regards to the head labor market assessment, the meeting is scheduled for the 10th of June, and it's going to be a blended session. So there will be some face-to-face and some persons that will be connecting virtually due to the issue of resources, availability of resources. So for those countries who will be participating face-to-face, Dr. Bolastic mentioned it would be those countries who have made progress with their HRH information system. So you'll be working actually on your data. Those countries who may have requested support with their HRH policies and plans. So based on that, those countries will be participating face to face, but all countries will be able to participate either virtually or face to face.
Thank you for the clarification, Madam
Sure,
Chair.
no problem. We also have CNO Edwards. I heard someone said Madam Chair. I am not sure. I don't see any other hand up. So please proceed, CNO Edwards, Chair of the RNB. We are not hearing you, CNO. CNO Edwards, we are not hearing you. Okay, so CNO Edwards is still having some difficulties. So we are going to proceed to item 11. The last measurement of the monitoring of the HRH plan of action. I believe Dr. Bolastic did comment on this earlier. Okay. And updates on any HRH publications. Do you have any updates?
Yes, there are certain publications
Sure.
that have been completed and will be shared widely with the membership. And also with regards to the Caribbean node of the virtual campus for public health, I wish to invite Fiona to share information on that. And I believe she may also have some information on these HRH publications, which were completed before my time. Over to you, Fiona.
Yes, thank you, Dr. Bolassi. Good morning to everyone. The Caribbean Node of the Virtual Campus for Public Health is the Caribbean's version of the virtual campus.
Sorry,
So,
excuse me, Miss Fiona, sorry about that. CNO Sutton, can you kindly turn your mic off, or can we have the mic and the, thank you very much. Please proceed, Miss Fiona, sorry about that.
yes, thank you very much, Chair. So as I was saying, we have our own version of the virtual campus for public health, which is really to include courses that are geared towards the Caribbean population, and it is available for use by any country in the Caribbean. The courses are done in English. What we are requiring is that you can liaise with us. I am the focal point for the Caribbean node. And so if there are different areas of interest in terms of education, if we can develop courses that are tailored to your needs. And we are encouraging member states to reach out and to identify what your needs are that we can meet. We have already started looking at different areas that we can improve. For example, we have started with looking at nursing education. So we are in the process of developing a course, particularly for Caribbean nursing personnel who are in education, the nursing tutors. So it is geared towards developing their competency in hybrid education. We know the COVID pandemic has taught us that we need to be prepared for everything, including being able to work in a virtual environment. And many of our nursing educators within Caribbean settings haven't had formal training. So we've had nurses who move from the clinical setting and go into nursing tutoring. And so we want to prepare the nurses and ensure that they have the competency to be able to work not just in a face-to-face setting, but within a hybrid setting, work online. So we have already started working on that. We've started working with different Caribbean countries to meet what their needs are. For example, with Barbados requesting MHCAP. So there are different opportunities for the virtual campus, and we are here to ensure that we meet your needs. And I would like to encourage that when we send out the courses that we have coming up, or the new courses that we have, that you circulate it within your population. Encourage the health workers to sign up for an account on the virtual campus for public health. And to do the courses, this is a way that we can keep continuing education. This is a way that we can keep our population of health workers up to date and build these competencies. What was the second question, Dr. Bolastic?
That was the one on
The
publication.
the publications. So if you remember, we had started to do the mapping of academic and training programs, where we looked at the different training programs that are available within the Caribbean setting that are geared towards strengthening HRH. And that was in response to the policy briefs on strengthening HRH within the Caribbean region. One of the policy actions, which was the third policy action, it was related to training and communication. So we had identified from you different programs that were geared towards strengthening HRH, and we had complemented it with internet search and desktop review, and we came up with a publication that is the mapping of academic and training programs, which is now available on ICES, and we can share it with you after this meeting. Also, the HRH core indicators that were identified from this group also has been created into a publication, a brochure, and a report. So you will have access to that, so you can identify what are the core indicators that were identified specifically for the Caribbean. We had chosen 30 indicators with sub-indicators. We know that the NHWA platform has since changed, and we've updated based on the changes that were made. So it is quite current, and it is something that we can use for HRH planning within our ministries and for helping to develop our HRH information system. And the third publication is related to the Caribbean node of the Virtual Campus for Public Health, where it gives an explanation of what it is and what are how it was developed and what are some of the recommendations we have related to how it can be further improved, because we really do want to see the Caribbean node grow. We would want to see that our health workers in the Caribbean have access to the most up-to-date information and that they are actually utilizing that information. So we have developed a publication on the Virtual Campus for Public Health, and that is also available. So Dr. Bolastic, with CARICOM, we can circulate among the member states so you can have an idea of what is happening with HRH within the Caribbean region. Thank you.
Thank you very much for those updates, Fiona. Most certainly, we will be sharing those publications, including the links, and so that all of our members will have access to these publications.
Okay, thank you very much, Dr. Bolastic, and thank you very much, Fiona, for those updates. Is there any questions or comments? If there is no other question or comments, I would recommend that we move the component, subcomponent of 9.3 to the next HRH Commission in regards to the update from the RNB with the midwifery education and regulation in the Caribbean, and the other the update on the meeting in Chicago, but Dr. Bolastic gave some summary based on that. So since we have concluded the agenda for today, if there is any other comments or any questions, we would like to request Dr. Bender, can you kindly inform us when is the expected date for the next meeting? Dr. Bender?
My apologies, Ms. Bell. Could
That's
you repeat? I
okay.
just had a break in connection.
Sure. We are deferring the item of midwifery education and regulation in the Caribbean to the next meeting.
Mhm.
And then we'd like for you to assist us with the next tentative date for the next HRH Commission meeting.
Yes, that is. Yes, Miss Bell, one moment. Let me check the calendar. So the next quarter begins in April, but ends in May. So it would be for the meeting to decide if they would like to have it earlier in the quarter or later in the quarter. Perhaps I believe on our end, there are a number of meetings taking place in April, so maybe the
Okay.
meeting could consider May.
Yes. Okay, so
if
we could agree to
we
May
consider
20.
May, it would be the second Wednesday, and that would be the 8th of May.
8th of May. Okay, so thank you very much, Dr. Bender. So the tentative date for the next meeting is 8th of May. We would like to encourage member states to provide the feedback to the Secretariat if you have not done so with regards to your alternate and your focal points, because this is a very important initiative, and we must ensure that we remain engaged and committed to the work of the HRH Commission, because the HRH Commission is actually us member states along with our different partners and the support of the Secretariat. The Secretariat and PAHO cannot do or produce without our support and our contributions as member states. I see Dr. Bolastic has his hand up.
Yes, thank you very much, Madam Chair. Before we end this meeting, I actually just would like to thank you, for your excellent leadership of the HRH Caribbean Commission, and even before when it was a task force. I would like to, before we transition to the new leadership by Dominica, that I wanted to make sure and put on the table our sincerest gratitude and appreciation for the excellent stewardship and leadership that you have demonstrated in steering the HRH Caribbean Commission to where it is at the moment. And we could see, if you just look at the active participation of all the members right now and how much it has achieved in the past in the past several years, and of course with the able support of the CARICOM Secretariat, we really would like to thank you and table our appreciation for your support.
Thank you very much, Dr. Bolastic. And I must also say thank you to the Pan American Health Organization, Dr. Bolastic, Dr. Puertes once more, and the CARICOM Secretariat, Dr. Bender and Ms. Fiona, who have been very committed to the HRH Commission. They have been working tirelessly to ensure that we move on with the different policy briefs. And definitely this was a learning experience for me, and I appreciate it. And also, I would like to take this opportunity to welcome our new chair, which is from Dominica, and we will continue to remain committed to the work of the HRH Commission, because that's the only way we can move some of the challenges and the gaps that we are facing as a region as it relates to HRH. So thank you all very much. Can we have two persons who move to adjourn the meeting for today as we close?
I so move.
Thank you. Second by?
I second the motion.
Thank you. Thank you, C.N.O. Smith. So have a pleasant good afternoon, everyone.
Thank
And
you very
thank you
much.
for your participation. Bye-bye.
Okay,
Thank you
bye-bye.
very
Thank
much.
you and bye-bye. Bye-bye.
Bye, bye.
Bye.
Thank you. Bye-bye.
You
Bye-bye.
have a good day.
Bye-bye.
Bye,
Bye,
everyone.
take care, folks.
All right.